is Shannon at Home Health Center.
Hi Shannon, this is Angie.
Yeah, hi. How are you?
Oh, fine, thank you.
Good.
I just got finished meeting with the Smith family and they do want to go ahead with our services. Yes, can you tell me what you have available this week?
Sure, let me look at our calendar. How's about 2 days from now?
Perfect, Tuesday sounds great. And what time?
Probably about 9 o'clock.
Perfect, sounds great.
Okay, great. And what's the address?
Yes, their address is 123 Palmdale Avenue in Hemet.
Perfect. Okay, thank you so much. Talk to you soon. Thanks, bye.
Hello.
Hello. Hello, I'm Shannon with the Home Health Service.
Come on in, nice to meet
And
you.
I brought my nurses.
Tommy, this is my wife Tiffany.
Hi, I'm Cecilia, the LVN. Cecilia, the LVN.
Hi.
I have had a student nurse.
Oh, from...
MSJC.
Oh my gosh, I've heard great things about that
Yes.
school. You guys have like almost 100% pass rate.
Yes.
And turn out really awesome nurses.
Yes.
Thank you.
I'm proud to be a member.
Oh, well, welcome, welcome. Come on in.
Thank
Have a
you
seat.
so much. First off, I wanted to thank you for having us over so we can do our initial review and just go over the process that we're going to be doing with your son and your family. And first off, I wanted to make sure it was okay that we do have a student nurse assisting Cecilia. If there's any time where she couldn't be here, Heather would be here to handle what was going to be.
Sounds good.
Yeah, great.
You'll only be sending specific schools then, right?
It should be only our school.
Okay, great.
Yeah, it's
Great.
Grace Health Center.
I'm comfortable with MSJC
Oh, thank
students.
you. Thank you. First off, is there any questions you had with us?
Well, the doctor really didn't go into much about the Lowe syndrome. So
Okay.
I was wondering if you had any other information that
Yeah,
could
if you can
help us.
help explain it to us a little bit
Okay.
more.
Cecilia did do some research because she will be the one handling your son's care. So.
I did some research online on Lowe syndrome, and from what I found, Lowe syndrome is a rare genetic disorder that causes physical and mental handicaps. Does your son Nathaniel have any mental handicaps that you've noticed, or?
Well, we did notice the cataracts almost immediately at birth, but
Okay.
the kidney issue didn't start until a little bit later.
Yeah, and that's what I found online. Lowe syndrome is caused by a defective gene. It's the OCLR1 gene, and because this gene is defective, an essential enzyme called a HIP2 phosphatase is not produced, and because this is not produced, it causes things to happen in the children with Lowe syndrome. The main three things involved are the kidneys, his eyes, and his brain. It mainly only affects males, but in very, very rare cases, there are females that have been known to have it. Like you said, your son was born with cataracts, which is one of the first signs. And also, not present at birth are the kidney problems, but later in life, the kidneys start to leak. They call them leaky kidneys. And this is known as Fanconi syndrome. So eventually, over time, he'll start losing bicarbonate, sodium, potassium, amino acids, organic acids, albumin, proteins, calcium, phosphatase, and L-carnitine. So you'll see these start spilling into his urine. So this is why the doctor suggested that you guys put a G-tube in place. So that way you can give him these essential things through the G-tube to help make up for what his kidneys are losing.
That makes more sense.
Yeah.
Does that make sense?
They
Okay.
really didn't explain, they just said it had to be done.
Okay. So yes, the medications you can take through the G-tube, and that's what I'll be here. However many hours is provided, I will be here to help you administer that medication to Nathaniel.
Thank you.
All right?
Well, I'll go get Nathaniel and you can come and meet him.
Yeah.
Okay, great. Thank you.
So Heather, before we go in to meet Nathaniel, I wanted to go ahead and give you a little quiz. Can you go ahead and tell me what the 10 critical behaviors prior to every procedure are?
Yes, I can. First, you're going to check the physician's prescription. Second, I will wash my hands before and after the procedures. I'll assemble my equipment. I'll identify my client by checking the ID band and or chart picture and ask the patient to state his or her name and date of birth. I'll introduce myself to the patient, provide for privacy and HIPAA confidentiality, explain the procedure to the patient using developmentally appropriate language and technique. I'll also remember to be sensitive to cultural differences. I'll use standard precautions at all times. I'll use proper body mechanics at all times. I'll refer to my textbook, Harry and Potter, and skills checklist for the steps of the skill I'm performing to maintain safety considerations at all times. And I'll report any abnormal findings to my instructor, my primary nurse assigned to the patient, and I'll document the procedure and the patient's response.
Okay, Heather, so now we're going to go ahead and do our hand washing before we do anything to Nathaniel. So go ahead and show us the proper techniques for hand washing.
Okay, if you don't mind, I'll be talking out loud. So I'm still a student, so I want to make sure that you hear every step
Of
I'm doing
course.
correctly. I will turn on the water, and I will get my hands wet, keeping my forearms and hands below my elbow. Gonna get some soap. And friction is important to get all the germs off your hands, so I'm rubbing in a circular motion in between my fingers.
And Heather, how many seconds do we wash our hands for?
I'm going to do this for about 10 to 15 seconds to get all the germs off of my hands.
Correct.
In between my fingers too, I don't want to forget anything. And then I'm going to make sure I move my watch. And before I shut off the water, I'm going to grab a towel and I'm going to dry my hands off. And then I'll shut the water off.
Okay, Heather, so now that we went ahead and we washed our hands, we're going to get Nathan's enteral nutrition ready. We already verified with Nathaniel's Mars that we are giving him the correct amount of enteral nutrition. So we're going to go ahead and put some gloves on.
And then as you're doing your gloves, Heather, could you tell us what the 7 rights to medication administration are?
Sure. I'm going to make sure I have the right patient, the right medication, the right dose, the right route, the right time. I'm also going to remember to document and know that the patient has the right to refuse that medication, and they always have the right to know what medication they're being prescribed.
Correct. And then what are you going to check with the medication?
First, I'm going to make sure that the expiration date is good, and February 8, 2013 looks good.
February 8th. We want to check that one?
Yes.
Okay.
Then I'm going to go ahead and shake them.
And we're going to go ahead and get the bag ready. You want to open those ones for me, Heather? Now this formula is only good for 24 hours after it's given. So on the bag we're going to want to note the date, the time, and then also put your initials on it and when you gave the enteral feeding. So you want to go ahead and get that ready, Heather?
Sure.
And then Cecilia, why would you want to only have the medication for 24 hours?
Because of what it's consisted of, it can grow bacteria.
That's correct.
Okay. So now that we got all 3 cans, we're going to go ahead and close it up. Okay, we're going to put the label on. Okay, and now we're ready to set up Nathaniel on his enteral feeding. Okay, so now that we washed our hands, we're going to go ahead and do Nathaniel's vitals, and we're going to do a full assessment on Nathaniel. So I'm going to go ahead and do his blood pressure. If you can go ahead and take pulse and heart rate for me, and then
Nathaniel,
respirations.
can I see your finger?
Yeah, see my finger.
Can I see this one?
See that?
Thank you.
Look.
We're going to watch it. It's going to be a little camera.
Okay.
See, look over here.
Huh.
Let's watch for the numbers.
Okay. Oh. Mommy. Mommy, what's that?
Let me see your finger again. It's got to read it. This finger out. Too far up. I'm going to go all the way up.
Mommy.
Okay, blood pressure is good. Heather, do you want to say what the normal blood pressure is for a child?
The normal systolic blood pressure would be anywhere from 95 to 110, while the diastolic would be anywhere from 60 to 75.
That's correct.
Okay, and his pulse rate is at 27, and his oxygen's at 99%.
You're doing very good.
Yeah.
Yeah.
Mommy.
So we're going to go ahead and take his temperature. Heather, if you can tell us what the normal temperature is for a child.
The normal axillary temperature will be anywhere from 96.6 to 98 degrees Fahrenheit.
97.2
Can you
is
wiggle your
normal
toes
temperature.
for me?
Yes. Take on my foot.
Wiggle your
Nathan,
toes.
can I go ahead and look in your eyes? Oh, beautiful eyes. Okay, I can see his cataract surgery in his eyes. I can see that. Can I see in your mouth, please? Oh. And also I read online that the teeth, the large palate and the teeth formation, that's normal for them as well.
Okay.
Okay. Look in his ears. Okay. All right, I'm just going to open your shirt, okay, Nathan?
Yes.
Oh, thank you.
Open my.
Okay, can I go ahead and take a listen right here?
Okay. Look in one hole.
Yeah, I'm going to listen to your heart.
Put it right here. Mommy, make a hole. Mommy, go.
Okay, I'm going to go ahead and listen to your lungs. Take a deep breath.
Mommy.
Deep breath. Deep breath.
Mommy, is that you?
Deep breath. Another deep breath. Another one. And okay, now I'm going to listen to your tummy, okay? So go
Okay.
ahead and lay back, and I'm going to listen.
Like that?
Very good.
Avoid it. Mommy, with the tapping. Mommy.
Oh, wow, they're active. Does this hurt your tummy when I do this?
Yes.
It hurts?
No, it hurts right here.
Oh, okay. But
Yes.
does this hurt when I do this?
Mm-hmm.
No dissension noted. So we're going to go ahead and take a look at his little hands. Okay. No edema noted. Okay. No edema noted on the foot. Okay. So everything looks good. So now we're going to go ahead and set Nathaniel up on his enteral nutrition.
Mommy.
Okay, but first we have to go ahead and verify placement. So,
Do Mama eating?
oh, is this your medicine?
Yes.
Okay.
Is that Mama eating?
Yeah.
Mommy, we just.
Okay, and I went ahead and I saw on his chart the x-ray to confirm the placement before feeding, and the x-rays showed that his gastrostomy tube is in correctly. But we're just going to go ahead and verify again by checking gastric secretions, making sure that the pH is correct, and then also we're going to auscultate as well, which we're just going to listen.
And you're going to do this every time he gets a feeding?
Yes, you want to verify placement every time.
Every time, okay.
Mommy, it's Mama eating? Mommy, what's Mama eating?
Oh, you have a little cough?
I'm starting I'm cold. Mommy, take me to have it to cover.
Okay, so I'm going to go ahead and pull back 30 mLs of air. And we're going to go ahead and attach it to his extension.
Daddy,
That's called an extension. I'm going to go ahead and get my stethoscope out again. We're going to take a listen.
Okay, look in the hall.
Yeah.
Now listen. You listen?
So listen to your belly.
Now it's going down.
Okay, I heard the gurgle sound in there. And now we're going to go ahead and draw up 10 to 15 mLs of gastric secretions.
Okay.
And you can see the gastric secretions coming back up.
Now it's going back up.
Okay, so I'm going to go ahead and give this to Heather, and she's going to go ahead and verify
Okay.
the gastric secretions, and it's going to be between 4 and 1 pH.
Looks good.
Looks good? Okay, if I can have the syringe back, Heather. Thank you. And we're going to go ahead and put this, whatever's left over, back into his little tummy.
Okay.
And I'm done with that one this one. Okay, so now that we verified placement, it's okay to go ahead and start him on his night feeds.
Oh, okay.
According to Nathaniel's Mars, he has 80 mLs an hour of intermittent feedings. So we're going to go ahead and start that up.
Hi.
So this is his first time. Is there anything special we need to know, or?
Yes, with the first time feeding,
Mommy.
after we start this medication, the enteral feedings, we're going to want to check it in 1 hour to make sure that his tummy's digesting all the food properly. So we're going to check it for an hour and pull back as much feeding as we get back, and hopefully we want to see 50% less of the 80 mLs that's going into his tummy per hour.
So
Okay?
we wouldn't do that every time. It's just the first time.
The first time you're going to check it for an hour, but after that you're going to go ahead and check it every 4 to 6 hours. Check his residual on his
Okay.
stomach. Okay? So we're going to go ahead. He's ready to be started on this. So we're going to start that. Okay. So now one thing that we see with the Mickey extensions, you see this little opening right here.
Yes.
You can go ahead and put a little piece of tape on there, because at night that'll open up
Oh,
and
okay.
the secretions will come right back out and spill everywhere. So we can put, Heather, if you could give me a little piece of tape off of there, we'll put that on. And then now we're going to go ahead and perform just some skin care around the area.
Okay.
Does Nathaniel, we checked his allergies, and all we saw is sulfa and
Plastic.
That plastic tape.
plastic tape.
Yes.
Okay, so
We
this
always
is
prefer the paper tape.
this is paper tape.
Great.
So
Hi.
you just put it on there like that.
Mommy, you take the tapping?
And as we said before, this is good for 24 hours. After 24 hours, you're going to want to go ahead and put a new bag on. You don't reuse these bags.
So is there a special position he should be in when he's having his feedings?
Preferably, they want them in high Fowler's
And
position.
that means,
At a 90-degree angle, or he can go into a
Semi-Fowlers.
semi-Fowler's position.
oh, okay.
Just until you see how he takes it to make sure there's no aspiration and he's tolerating the feedings
Take the
well.
tapping.
Okay, so now we're going to go ahead and we're going to do skincare. Heather has some normal saline here, and you just use normal water, normal saline, and then just soap to go ahead and clean the area. And then we just use a gauze. And we're just going to go ahead and clean his G-tube area.
Mommy, open my bottle.
Okay, and then you're going to
Good boy you are.
you're going to want to dry it thoroughly. You want to keep this nice and dry.
Mommy, it's my bottle.
And then we're going to put another 4x4 gauze.
They take your vitals already.
Yes.
Yes, and listen to your heart. And oh, and it
Zombie.
sounds good. I'm a zombie. Oh,
Now you the tapping.
So we're going to put another 4x4 gauze here with a piece of tape. Heather, if you can give me a tape.
You the tapping.
Okay, just this little piece of tape here on the gauze is just to secure it so it doesn't fall off. Okay.
Oh, that's easy.
And
It's
there you
not-
go. He's on his feedings.
Wow, thanks guys. You've really shown us a lot.
Did
Had
you have
no
any
idea.
questions?
No, you're so thorough. Thank you so much, and you interacted so well with him.
And we're going to come back, like I said, in an hour, and we're going to check his residual and make sure he's tolerating the feedings well. Okay?
Great.
Great, thank you very much. Hi, Miss Jones. How are you?
Hi, good.
Come on in.
Thank you.
What
Good to
brings
see
you
you
by?
guys again. I was in the neighborhood and I just wanted to follow
Okay.
up. Hi, Mrs. Smith. How are you?
Nice to see you
Good.
again.
I just wanted to follow up and see how your services have been for the past couple of weeks.
Well, we were so pleased with the nursing staff that came out. They were so thorough. They explained a lot. They even did research on my son's syndrome.
Yeah, they're very professional. We've been very happy with them.
Good. We've been very happy with their services as well. So no questions, no concerns at this point?
Not as of right now.
Okay, well feel free to call me anytime if you need my assistance with anything. Otherwise, they will continue to provide their services every week and we'll go from there.
Great.
Great, thank
Thank you
you.
so much, okay?
Thank
You guys
you.
have a wonderful day now.
Appreciate you coming by.
Take care. Bye.